doctor in 1982 was just the beginning of my training, because you then have to work long hours as a junior and study for professional exams at the same time. I spent 6 months in general medicine at Charing Cross Hospital, and then 6 months in general surgery at King Edward VII Hospital in Midhurst on a 1-in-2 rota. That is, working all weekdays and every other night and weekend on call. I can't remember any major calamities because we worked in firms and responsibility could be passed upwards very quickly, with housemen doing the routine clerking, initial examination and bloods, and then presenting to a registrar or to the consultant. Before I moved on to my psychiatric training, I went to Taunton to become a senior house officer in general medicine. It was felt that in order to go into psychiatry, they needed more mature trainees. These 2 years were incredibly busy and certainly gave me the experience and confidence I would need for psychiatry. At the end of my contract there, I applied for psychiatric training at the Royal Free rotation and spent 6 months in Halliwick House, the Whittington Hospital, the Royal Free and Free and Barnet. I also spent a year at the Tavistock and at St Albans. I passed my membership, my professional examination of the Royal College of Psychiatrists, and then moved to the Institute of Psychiatry to carry out research. After that, I moved on to the higher training scheme at the Maudsley as a senior registrar and worked in the emergency clinic at the Maudsley, at the Felix Post Day Hospital, at King's College Hospital and the Royal Marsden. And I eventually became a consultant in 1994, working in old age psychiatry with my, at the Royal Free, with my main clinical work being day hospital patients and our community team seeing patients in their own homes, and that's patients with all conditions, all psychiatric conditions, including people with dementia.